Hey guys, welcome back. Today we are going to talk about cosmetic dermatology and particularly one procedure called CoolSculpting and the potential complications that can arise with that. These complications are uncommon but have recently become nationally recognized because of Linda Evangelista, and we're going to talk about her story. So let's jump into it. Cosmetic procedures have been increasing in popularity for years, and some of the most popular include Botox injections, filler injections, and, as of late, non-invasive body contouring. Now, body contouring has been popular for a long time, but traditionally, liposuction has been the go-to, meaning you have to go through an invasive procedure. Sometimes you have to be actually put to sleep for that in order to have the liposuction done. Now, that, of course, poses additional risks. CoolSculpting was developed by a company called Zeltiq, and it really revolutionized the body contouring segment of cosmetic procedures because it was truly non-invasive. There's no anesthesia needed and nothing had to go inside your body the way that it does for liposuction in order to perform the procedure. So CoolSculpting became very popular very quick. It was actually developed by dermatologists who noticed a condition called popsicle paniculitis or cold-induced paniculitis. What that means is that during cold exposure, there's certain individuals who will get atrophy of the fat. Now, popsicle paniculitis was a condition that was noticed when kids who were eating popsicles all summer started to get a hollowing of their cheeks because they were eating so many popsicles all day long. Their cheeks were constantly cold, and it actually damaged the fat cells. So that discovery of popsicle paniculitis led the investigators to look into this further, and eventually it led to the development of CoolSculpting, which was the application of something outside, a special applicator that gets really super cold to freeze the fat, because the fat cells are much more sensitive to cold exposure than your normal skin. So you can actually cause damage to the fat cells before you get frostbite on the skin. Now, CoolSculpting was developed by a company named Zeltiq. That was sold to a company named Allergan. Allergan also owns the rights to Botox and to Juvederm and to a type of breast implant, so they're very big in cosmetic medicine. Last year, Allergan was actually purchased by AbbVie, a major pharmaceutical company, and so it's gone through several ownership changes. During the time of CoolSculpting's life cycle, the machine has improved, the applicators have improved. The overall concept of CoolSculpting is that you have a machine that has basically like a refrigeration unit inside it that gets super cold and pumps very, very cold water into an applicator that's placed on the body. Now, the applicator also has suction built into it so that you can put it on the flanks, for example, or another area where you have unwanted subcutaneous fat, and it sucks the skin and the fat into the applicator, then makes it very cold on both sides. The fat is damaged over the course of 35 to 45 minutes, but the skin is not damaged. It does get cold. And then over the course of the next 6 weeks or more, the fat cells that were frozen go through a process called apoptosis or programmed cell death, and 20 to 25% of the fat cells in that area will then be eliminated by the body permanently. You don't grow new fat cells, so this is a very effective way to shape the body, to contour the body a little bit at a time, 20 to 25% of the fat cells in an area. If you have a little bit more, you can do the procedure a couple times in the same area to get 40 to 50% of those fat cells eliminated, and I suppose you could even repeat it a third time if you needed to. Now, CoolSculpting is not designed for weight loss, so you don't actually change your weight significantly when you go through a CoolSculpting procedure, but you can improve the way that you fit into jeans or bathing suits, or just shape your body a little bit better to your liking. But this procedure overall has been done hundreds of thousands, millions of times very safely. Over the life cycle of CoolSculpting, the machines have improved to become more efficient, so treatment times can decrease, and the applicators have been a little more patient-friendly. Initially, the applicators were very bulky and broad, and they had to suck your skin and fat in very hard, and it was a little bit more painful. The second generation got a little bit more friendly, so it didn't have to suck in as much. It was able to freeze a little bit more efficiently. Those treatments got faster and more comfortable, and now they're even on to their third iteration where the treatment times are improved. You can do multiple areas at one time, and they just keep getting the technology better and better. Overall, this is a treatment that works really well for most people that undergo it, and it is a cosmetic treatment, so it's somewhat expensive. It's not inexpensive, and it is a treatment that I even offer at my clinic. Now, CoolSculpting is something that most people can go through. There's not a lot of contraindications to doing it. If you have certain cold exposure type diseases like cryoglobulinemia or other things, you're really not a good candidate for CoolSculpting because it can cause complications, but most people can go through it without any difficulty. Some of the main side effects that you might experience are bruising, and a little bit of numbness for a period of a week or two is not uncommon in an area that was treated, but most of the time that goes away without any difficulty. Now, the reason that this has come to national prominence once again is because of a very rare side effect called P.A.H, or Paradoxical Adipose Hyperplasia. So of course, when you treat an area with CoolSculpting, it's supposed to get smaller, but we don't understand why in a small percentage of people, like really small, it actually can cause the fat cells to almost like get angry and enlarge. So the area can get bigger, and retreating with CoolSculpting does not fix the problem. These people really have to go through liposuction in order to eliminate those fat cells. Linda Evangelista is a fashion model. She has been considered one of the world's top supermodels, and she claims that she went through this CoolSculpting procedure and developed paradoxical adipose hyperplasia, which is really a dreaded complication. And she claims to be permanently disfigured by this and has now filed a lawsuit against Zeltiq, which is now, as we explained, owned by AbbVie. The questions at hand here is, was that risk disclosed to her during her consultation? Was she made aware of it? Now, when you sign the consent form for CoolSculpting, it is well outlined in there, but it may be something that wasn't properly explained by the individual who was supervising or performing that treatment for her. She also claims that this risk was not disclosed on the Zeltiq website for CoolSculpting until after she filed the lawsuit. This warning didn't appear on the Zeltiq website until 2019. Now, in reality, we don't know what the outcome of this lawsuit will be. I think it's very tragic that she had this complication and that other people have had this complication as well. One study estimated the incidence to be less than 0.005%. Another study that followed up found an incidence as high as 0.47%. I think the truth is probably somewhere in the middle there. Of all the patients that I've treated in the clinic with CoolSculpting, we haven't seen this complication in any of my patients, knock on wood. Individuals who are at higher risk for P.A.H are men, and individuals treated with the original CoolSculpting system seem to have the complication just a little bit more than successive iterations of the machine, the Generation 2, the Generation 3. I, of course, don't speak for the company and have no conflict of interest with them other than I own the machine and I perform the procedure here in my clinic for my patients, but I'm not paid by Zeltiq. I'm not reimbursed by AbbVie. I'm simply stating the facts of the case here. If I had to guess, I'm guessing that this will be settled out of court, but I really don't know what the outcome will be. But if you are going through any cosmetic procedure, you really need to make sure that you are asking what are the potential risks and complications, and if those are not properly disclosed to you, then that could be a malpractice type of case. Always remember to make sure that your cosmetic procedures are supervised by a board-certified dermatologist, a board-certified plastic surgeon, a board-certified facial plastic surgeon, or oculoplastic surgeon. Those are the specialties that are really trained in cosmetic procedures, and some of those should only be performed by certain specialties who receive that training in their residencies or fellowships. But certain things like CoolSculpting, Botox, fillers can be performed by usually all of those specialties, and it would be within their scope of practice. I'll be awaiting the outcome of this, and I'll be sure to update you guys on what happens with this lawsuit. In the meantime, I certainly wish Linda a speedy recovery. I hope that she can get resolution of this, both for her own personal comfort, safety, image, and health, and that anybody else that may have experienced this side effect can also get some closure on that. If this may have happened to you, definitely talk to the clinic or the doctor that performed the procedure in the first place, because there are protocols outlined by the company to help remedy this and make sure that an individual can get the right kind of treatment to make sure the problem goes away. Let me know if you guys have additional questions about this case. If you do, make sure to drop them in the comments down below, and I'll try to answer the questions as they come up. Thanks for tuning in, and I'll look forward to seeing you back next time.